Imagine stepping into a hospital corridor in 2024. You're surrounded by gleaming stainless steel, bright LED lighting, and the soft hum of advanced medical equipment. Doctors and nurses move with precision, wearing layers of protective gear, N95 masks, face shields, blue surgical gowns, and double gloves. Every surface is sanitized. Every patient is monitored by digital displays showing heart rate, blood oxygen, and respiratory function in real time. If you're finding this comparison fascinating, please subscribe to the channel so you don't miss deep dives like this one. Now shift your mind back to 1347. Imagine a cramped stone building in medieval Europe, lit only by flickering torchlight. The streets outside are narrow and filthy, littered with rat droppings and human waste. Bodies wrapped in cloth are piled onto wooden carts. People are dying so fast that mass graves can't keep up. There's no understanding of germ theory, no antibiotics, no ventilators. Instead, physicians in long dark robes and beaked leather masks, the beaks stuffed with herbs they believe will protect them, perform bloodletting and apply leeches. They're treating a disease they can't see with remedies that make things worse. The contrast is almost incomprehensible. In less than 700 years, medicine has transformed from superstition and desperation to science and hope. Let's explore how modern pandemic doctors and the physicians of the Black Plague represent two completely different universes of medical knowledge and capability. The Black Plague killed between 75 and 200 million people across Europe, Asia, and North Africa. That's roughly 30 to 60% of Europe's entire population. The disease spread through fleas on rats, though nobody knew that then. People blamed miasma, bad air. They blamed planetary alignments, witchcraft, and divine punishment. Entire families were wiped out in days. Entire villages were abandoned. The psychological terror was as lethal as the disease itself. Doctors in 1347 had almost no tools. They had no microscopes, no blood tests, no x-rays. They couldn't identify the bacterium Yersinia pestis, which was the actual culprit. They relied on the four humors theory, the idea that illness came from imbalances of blood, phlegm, yellow bile, and black bile. Their treatment was crude and harmful. Bloodletting was considered a cure-all. They'd open veins and let patients bleed, believing they were releasing evil humors. They'd apply leeches. They'd prescribe mercury, arsenic, and lead. Some physicians recommended sitting between two roaring fires to sweat out the disease. Others advised breathing in the smell of human excrement. The more desperate the disease, the more bizarre the cure. Medieval hospitals barely existed, monasteries, or their own homes. There was no isolation, no containment. If you were sick, you infected everyone around you. Monks and nuns tried to care for the dying, but they died too. Entire religious communities were wiped out. The death toll in some cities reached 80%. Mass graves became the norm. Bodies were buried in layers, sometimes with lime poured over them to speed decomposition. In some places, they simply burned corpses to make room for more. The Black Plague represents humanity's helplessness against disease when armed only with guesswork and fear. Now let's jump to the modern era. When the COVID-19 pandemic emerged in 2020, doctors had weapons their medieval predecessors could only dream of. Within weeks, scientists had sequenced the entire genome of SARS-CoV-2. They knew exactly what they were dealing with, a virus, not a miasma or a divine curse. They knew how it spread through respiratory droplets and aerosol transmission. They could detect it with RT-PCR tests that work at the molecular level. Hospitals deployed ventilators that mechanically breathe for severely ill patients. CT scanners provided detailed images of lung damage. Doctors could measure viral load, antibody response, and immune markers with incredible precision. Modern pandemic doctors wear multiple layers of protection. N95 masks that filter 95% of particles, face shields that protect mucous membranes, gowns that prevent skin contact, and gloves that create a barrier. These aren't medieval superstitions. They're based on rigorous understanding of how disease actually transmits. Hospitals are designed with negative pressure isolation rooms that prevent contaminated air from escaping. Air is filtered through HEPA systems and UV sterilization. Everything is cleaned with hospital-grade disinfectants proven to kill pathogens. Modern doctors had access to decades of epidemiological data from previous pandemics. They knew that testing, isolation, and vaccination were effective. They implemented contact tracing, using technology to track disease spread in real time. They deployed vaccines in less than a year, a feat that would have seemed like pure magic to medieval physicians. The vaccines worked by teaching the immune system to recognize the virus's spike protein. This was molecular engineering at its finest, nothing like the trial-and-error poisonings of the medieval era. Modern pandemic doctors also had psychological support systems. They could call on psychiatrists, counselors, and social workers to help patients cope with the fear and isolation. Medieval doctors had prayers, and that was it. The infrastructure difference is staggering. Modern hospitals have electronic health records that track every patient's medical history instantly. Doctors in different cities can consult in real time through video calls. Medications are standardized and quality controlled. Supply chains can transport specialized equipment across continents in hours. Medieval physicians operated in complete isolation, with no way to share discoveries or learn from colleagues in other regions. Some never even knew what was happening in the next town. The death rate tells the story. During the Black Plague, mortality among infected people reached 90% in some estimates. Among COVID-19 patients, even in the early days of the pandemic before vaccines, mortality rates were typically between 1 and 3% in developed countries with modern medical care. With vaccination and advanced treatment, that number dropped further. The difference between 90% death and 2% death is the difference between medieval medicine and modern medicine. But here's something important. Even with all our advantages, modern doctors faced real challenges. The virus mutated constantly, forcing them to update vaccines. Hospital systems became overwhelmed in some areas. Healthcare workers suffered trauma from the constant exposure and the deaths they witnessed. Some patients refused vaccination or rejected evidence-based treatment. Modern medicine is powerful, but it requires cooperation, trust, and a population willing to accept scientific evidence. Medieval doctors didn't have those challenges because nobody expected anything from them. They were already failing. They couldn't do better than they were doing because they literally didn't understand disease at all. Modern doctors could fail by not implementing what they already knew worked. That's a different kind of pressure. Another key difference is the speed of innovation. When COVID-19 emerged, researchers around the world immediately began sharing data in real time. Universities and pharmaceutical companies collaborated at unprecedented speed. The vaccine development timeline was compressed by running trials in parallel rather than sequentially. Funding was unlimited. Bureaucratic obstacles were removed. In medieval times, if a physician discovered something that worked, it took decades or centuries to spread to other regions, and most of it never spread at all. Knowledge was closely guarded. Literacy was rare. There were no journals, no conferences, no scientific community. Each physician was essentially working alone. The social response was different too. In medieval cities, many people refused to believe the plague was real. Some blamed religious minorities and attacked them. Others fled, spreading the disease further. Fear led to cruelty and irrationality. In the modern pandemic, while some misinformation spread, scientific institutions were able to reach millions with accurate information through media, schools, and public health campaigns. Not everyone believed it, but the infrastructure for truth-telling existed. Medieval doctors couldn't even communicate clearly enough to explain what was happening. Modern doctors could hold press conferences, publish data in real time, and reach every corner of the world through the internet. The difference in accuracy is profound. Medieval physicians were often wrong about everything: the cause, the transmission, the treatment, the prognosis. Modern doctors are sometimes wrong about details, but they're right about the fundamentals. They know disease comes from pathogens, not planetary alignments. They know vaccines work, not leeches. They know isolation prevents spread, not bloodletting. Modern doctors also had the advantage of history. They knew what had happened during the Spanish flu pandemic of 1918. They knew what happened during the SARS outbreak of 2003. They had models and protocols based on actual experience. Medieval doctors had no templates, no precedent, nothing but blind panic. The emotional toll was different too. Modern pandemic doctors experienced burnout, grief, and moral injury from overwhelming demand and tragic losses. But they also experienced hope. They knew that treatments were improving. They could see a light at the end of the tunnel, even if it took longer than expected. Medieval physicians experienced only helplessness. They watched people die day after day, knowing there was nothing they could do. The psychological burden must have been unbearable. If you found this comparison between these two worlds of medicine valuable, please give this video a like. It really helps the channel. Let's consider the legacy of these two eras. The Black Plague changed Europe forever. It killed so many people that labor became scarce, which actually improved conditions for surviving workers. Serfdom began to decline. Women entered the workforce. Education became more valued. The plague is one reason medieval Europe eventually gave way to the Renaissance and the modern world. But the cost was unspeakable. 200 million people died. Entire civilizations were disrupted. The trauma lasted for centuries. The COVID-19 pandemic, by contrast, killed around 7 million people globally. A tragedy, but vastly smaller than the Black Plague, even though the world population was 50 times larger. That disparity is entirely due to modern medicine. Imagine if COVID-19 had emerged in 1347. It would have killed billions. The world would have been depopulated. Civilization as we know it might have ended. Our survival depended entirely on having inherited the knowledge and infrastructure that 7 centuries of scientific progress had built. Modern pandemic doctors didn't create that infrastructure overnight. They inherited it from thousands of scientists, doctors, and public health officials who came before them. They stood on the shoulders of giants, people who developed germ theory, antibiotics, vaccines, and the scientific method itself. The contrast between medieval and modern pandemic medicine isn't really about individual doctors. It's about the accumulated knowledge of an entire civilization. Medieval physicians did the best they could with what they had. They were intelligent, dedicated people trying to save lives with no understanding of what they were fighting. Modern doctors inherit centuries of knowledge that medieval physicians never could have imagined. The real question isn't whether modern doctors are smarter than medieval ones. It's whether we deserve the tools we've inherited. Are we using modern medicine as effectively as we could? Are we sharing knowledge globally? Are we preparing for the next pandemic? Are we investing in pandemic preparedness? Are we listening to the evidence? The Black Plague teaches us that disease doesn't care about your beliefs, your politics, or your wealth. It kills indiscriminately. Medieval people couldn't stop it because they didn't have the tools. Modern people can largely stop pandemics, but only if we're willing to use the tools we have. The contrast between these two eras is ultimately a mirror held up to our own choices. We can do so much more than medieval doctors could dream of. The question is whether we'll do it. I'd love to hear from you. If you could go back and give one piece of modern medical knowledge to a medieval doctor, what would it be? Would you tell them about germ theory, antibiotics, vaccines, or something else? Drop your answer in the comments. And if you found this exploration of how far medicine has come fascinating, please subscribe to the channel for more deep dives into history, science, and the incredible progress humanity has made.